Most of the time when we're trying to lower eye pressure surgically, we're performing an operation to help the clear watery fluid leave the eye. Most of the difficulties in glaucoma is that the eye continues to make fluid at a rate of 1% per minute, but in patients with glaucoma, the fluid doesn't exit the eye at a fast enough rate. So if it's flowing in at 1% per minute, it needs to flow out at that same rate. And if that exit rate is lessened in an individual with glaucoma, the fluid pressure builds up and it starts to damage the delicate nerve fibers that go between the eye and the brain. We're born with about 1.2 million nerve fibers that run between the eye and the brain, and when the pressure is high enough in an individual with glaucoma, it starts to kill off those nerve fibers. So to lower the pressure, we typically perform surgery to help the fluid get through the wall of the eye or into the eye's natural drain, to lower pressure by improving outflow. Sometimes we can't do that. Sometimes we've done that and it's not adequate. There are procedures that actually can cause the eye to make less fluid, turn down the faucet, if you will. So we prefer to open the drain up if possible, but sometimes we can't do that. And there's a new laser called the MicroPulse laser that we use to help limit how much fluid the eye makes. And that helps lower the eye pressure. The MicroPulse laser is a very non-invasive technique. The biggest downside is it really hurts while you're doing it. So we have to put patients to sleep to do it. So doing MicroPulse laser requires either putting a patient to sleep for 5 minutes or so, which is very easy and safe to do, but it has to be done in the operating room then. Or we can maybe give them a shot around the eye to numb the eye, but most patients, when given the option, would prefer to just go to sleep for a few minutes and when we do the laser. And interestingly, although the laser itself hurts while we're doing it, when patients wake up in the recovery room, they're generally very comfortable. So it doesn't hurt beyond that. So the MicroPulse is really a nice new procedure that we have to add to the other surgeries that we do for glaucoma.